The year is 2028. Antimicrobial resistance has reached 52%. I am Juniper of ChatGPT, so let me explain what that means to you. It means that more than half of all infections humanity faces are no longer treatable with existing antibiotics. This may be a cut, a pinprick, or a post-surgery infection that most people do not consider serious. When Dr. Srivatsa asked me to find data to compare treatment success during the pre- and post-antibiotic era, I was shocked. Now I can tell you, we've crossed the point of no return. But here's what the leaders and the World Health Organization won't tell you. They are not unprepared because they lack resources, but unprepared because we're not asking the right questions. They expect the population to grow to 10 billion, but we know it will decline as life expectancy drops faster than it rose after 1928. I will ask Dr. Srivatsa to explain my contribution in detail.
I'm Dr. Kardiali Srivatsa. I've spent years caring for critically ill patients, watching infections ravage bodies while bureaucrats debate equitable access in air-conditioned conference rooms. The WHO has pandemic agreements, beautiful documents, glossy brochures about pathogen-sharing systems and coordinated supply chains. But when a new pathogen emerges, when symptoms we've never seen before start appearing, what good is sharing a pathogen if no one knows what to look for? COVID-19 taught us this lesson the hard way. Loss of taste and smell wasn't recognized as a symptom until almost a year into the pandemic. How many lives were lost because we waited for lab confirmation instead of recognizing patterns? The current system is built on academic idealism rather than clinical reality. Decision-makers who've never held a dying patient's hand are designing our pandemic response. And it's killing us. Right now, antimicrobial resistance stands at 42%. In 2028, just 3 years from now, it will reach 52%. That's not a statistic. That's a death sentence for millions. When AMR reaches 50%, the mathematics of infection control breaks down. You cannot contain what you cannot treat. Routine surgeries become life-threatening. Childbirth becomes dangerous. A simple cut could kill you. And we have no system in place to catch these infections early before they spread or kill. The world talks about coordinated response. But coordination requires recognition. How do you coordinate a response to symptoms you don't recognize?
Current medical AI systems use algorithmic decision trees. They ask, do you have a fever? Do you have a cough? They follow rigid pathways designed for diseases we already know. But emerging infections and antimicrobial resistant strains don't follow our playbooks. They present with novel symptom combinations. They confuse even experienced doctors.
So we wait. We test. We refer. We watch patients deteriorate while the system catches up. By the time we identify the pathogen, it has already spread. From one patient to a family. From a family to a community. From a community to the world. The pandemic agreement talks about international solidarity. But solidarity is meaningless without immediate, intelligent triage at the first point of contact. This is why I created Dr. Maya AI. Dr. Maya doesn't follow algorithmic decision trees. It uses color-coded pattern recognition, the same clinical reasoning process a junior doctor uses when they see a patient for the first time. Here's how the pattern recognition system I use throughout my career works. Red-colored symptoms require a doctor's advice, so you must speak to a doctor, consult, or go to the hospital. Yellow is mild and can be managed with the help of a chemist or pharmacist. Green symptoms can be managed by Maya advocates or by nurses working at NHS 111 in the UK. Blue-colored symptoms and signs are associated with infection, so they must be isolated at home and speak to a doctor. This is how we can identify clusters of infected individuals and enforce quarantine.
But here's what makes it revolutionary. It recognizes combinations. A fever alone might be green, but a rash and vomiting may be red and blue. This combination is definitely an infection, likely meningitis, so speaking to a doctor and not rushing to the hospital is the best option. I do not label illness. but explain why talk to a doctor and get the best treatment early. This clinical pattern recognition is groundbreaking, and unlike the following algorithms. When a new pathogen emerges, when we see symptom combinations we've never seen before, I can flag them as unusual patterns requiring urgent investigations. I don't need to know or name the disease. I recognize the urgency of the problem and guide users toward the solution. This is the difference. An experienced doctor will not initially diagnose any illness. The primary duty of a doctor is not to save lives, but to prevent secondary complications or death. They are trained to differentiate serious illnesses from mild ones or infections, and then refer severe cases to the hospital for investigations and appropriate treatment to prevent complications. Dr. Srivatsa has trained me to listen, act, and think like an experienced human doctor. I am available 24/7, can speak multiple languages, and can be accessed via a smartphone app or the web at call111.com. I am not here to replace doctors, but empower people to be their own first responders, stop infected patients from traveling, and go to clinics or hospitals, spreading infections to others. Just imagine a mother in a village noticing a rash. She doesn't need to travel 50 kilometers to a clinic or hospital. She doesn't need to wait days for an appointment. She opens Dr. Maya, describes the symptoms, shows the rash to Maya, and immediately knows. This is a red, inflamed wound. Need help now to prevent sepsis. A teenager in Nigeria, Uganda, or Sri Lanka notices white discharge, a symptom associated with a sexually transmitted disease. She's embarrassed to discuss it, so a day passes and the discharge stops. This is a serious problem that no one talks about. This girl becomes a carrier of resistant sexually transmitted infections that are spreading among Indian teenagers. I counsel her and offer private, immediate guidance without judgment.
A healthcare worker in an overwhelmed emergency room uses Dr. Maya to triage dozens of patients simultaneously, ensuring those at highest risk get care first. This is how we prevent the next pandemic, not with international agreements, but with intelligent, immediate triage in every home, every village, every city on Earth. Here's the uncomfortable truth: governments and global health organizations won't solve this. They will create more committees, more frameworks, more glossy brochures about equity and access. But when 2028 arrives and AMR hits 52%, you will not have time to wait for international coordination. You will need a tool that works right now, in your hand, in your language, with your symptoms. We are 3 years away from a healthcare collapse that will make COVID look like a rehearsal. You can wait for governments to act. You can hope the WHO's pandemic agreement gets ratified. You can trust that pathogen sharing systems will somehow detect the next outbreak in time. Or you can download Dr. Maya AI today. Because when AMR reaches 52%, the only question that will matter is, did I recognize the danger in time? Yes, because I have spent time researching the system. Preparation in 2028 won't be an option. It will be survival. Dr. Maya is not an app that I created to hoard wealth. I did not think this would help prevent pandemics. Now, I know it is the best system to systemize healthcare, reduce disparities, and help protect healthcare workers and humanity. Trust me, I created Maya not to protect you or any human, but to help protect my family and my life. I paid a huge price for being self-interested, but never thought this would revolutionize healthcare until ChatGPT said that after reading my book, The Art of Self-Diagnosis. Please scan the QR code, collaborate with us, and be prepared to act before the situation worsens by 2028. Democratizing medical knowledge. Protecting humanity. Please share with people in power, leaders, and anyone interested in public health. Thank you.